So let's talk about regenerative medicine in a post-COVID world. After all, what's happened to most of us is we're sort of frozen in place. No action has taken the place of definitive plans. So what I want to do is I want to put together an outline that shows you how you can rationally proceed with some of the new stem cell and regenerative products to make major changes in your health. A lot of you have been putting off solutions to knee pain, back pain, dementia, inflammation in general. This is really a plan to help you get unstuck. First, let's do introductions. So we're 25 years functional medicine. I'm an integrative and functional medicine doctor. I started out as a chiropractor doing holistic orthopedics. I went on to biochemistry, then advanced neurology. I have 25 years of advanced diagnostics. I'm an autoimmune expert. I think I'm a good functional medicine doctor. Our clinic is in the third year of administration of stem cells, which is as long as anybody in the United States has been doing this commercially. We're an innovative clinic. If there's a piece of technology that helps us utilize regenerative procedures, we are going to pursue it. So we have the highest powered pulse electromagnetic generators. We have Synexus generators. We are using neurofeedback and brain scans. Our clinical operations include an MD, a DO, a nurse practitioner, a medical assistant, and a massage therapist. Pretty much we're going to apply the best of both sides of medicines to get you the answer. I would say the thing that distinguishes us more than any other thing is the ability to come in with multiple dimensions across physical, biochemical, neuro, and energetic guidelines. In fact, at this point, regenerative medicine has probably done more for integrating medicine, and let me define that term. Integration means conventional doctors like MDs working with so-called integrative or complementary doctors, which was sort of a disparaging term in the day. There was kind of like the inside group and the outside group. Osteopaths are somewhere in the middle. Naturopaths are farther down the line, acupuncturists, and then probably chiropractors were last in that group. What's happened with regenerative medicine is it really matters, if you can diagnose, if you can figure out the orthopedics, because a lot of this is really physical medicine. So chiropractors, acupuncturists are probably going to the head of the class on that. Neurologists, neurosurgeons, orthopedists have a physical capability, and then everybody's kind of trying to learn the regenerative side of this. At this point, there's 800 clinics, mostly managed by functional and integrative medicine practitioners. There's certainly a good number of orthopedists that have switched from surgery. In general, everybody's working on joints. Some people are working on arthritis like we are. Advanced clinics are handling dementias and more complex neural conditions. In all cases, regenerative procedures have turned out to have almost no adverse medical events. In the procedures that are using sort of harvested, like repurposed adult stem cells, those clinics are experiencing a 2% adverse medical event. So it means somebody went to the hospital or perhaps worse. So when they harvest your own stem cells, there is a little bit of danger, but these numbers are still significantly lower than any surgery anybody's talking about. When we're talking about using birth products, amniotic stem cells or amniotic derivative products, or stem cells directly from the umbilical cord, there's been no adverse medical events. What's happening in the future with these developments is we're beginning to get sprays for wounds, we're beginning to get patches for wounds, we're beginning to get treatment protocols that are addressing almost every kind of inflammation and every kind of intercellular rebuilding. So the last 3 years have really done a good job in terms of like providing a new basis for applications for safe and effective stem cell usage. So what do stem cells do? It's kind of interesting. When we're looking at stem cells and seeing the benefits, probably the single biggest benefit that patients realize is happening is the inflammation effect. So anti-inflammation. So a stem cell can go into a knee or a knee capsule and take away the inflammation, sometimes in a matter of hours, usually in a matter of days, and maybe weeks, depending on severity. So they're anti-inflammatory. Then stem cells, by their very nature, regenerate tissue. We were all born with two individual cells that then differentiated into 12 tissue types, 122 ultimate kind of different kind of cells. The stem cells we're using can do that exact same thing. So when we're injecting stem cells into a knee capsule, for an example, it's going to go into that capsule. It's going to decrease the inflammation. It's going to recreate anything that's damaged, because that's how stem cells work. They use a chemotaxic signal to recreate damaged tissue. So if you use an IV, which is an advanced application for, let's say, arthritis, it's going to go in and systemically reduce the arthritis. The other conditions or the other characteristics of stem cells is that stem cells are, in addition to being anti-inflammatory, they're autoimmune modulatory. So it means just like vitamin D can balance out the two sides of your immune system, the Th1, Th2, cell-mediated immunity versus antibody immunity, stem cells can do the same thing. So stem cells almost inadvertently help with autoimmune conditions. So when we're looking at the complex long-term diseases, if we're doing an IV of stem cells, most of the time that's going to be a very good first position to take. An IV of stem cells, again, is going to go in a vein up to the heart and then feed the lungs. So conditions like COPD and actually much worse pulmonary conditions can be helped with stem cells. Everything I'm saying now has good research on it, but is not widely publicly accepted. So one of the things that we're looking at with stem cells is, now that we're at the 100,000 mark of these so-called experimental stem cells, we're beginning to get clinical protocols that are more or less accepted in the industry. So the last thing that stem cells do is they actually help either rewind or rebuild the telomere tails of DNA. So one of the hopes for stem cells, and we can't tell because the proof's kind of in the pudding, is that we're looking at longevity. So stem cells certainly make you feel younger. There's a question and a hope that they actually make you live longer. So when we look at slides like this, we go, wow, you can make new cartilage, you can make new synovium, you can make new blood vessels, you can make new nerve cells. So stem cells become kind of a Swiss Army knife for fixing almost any tissue damage or any joint application. So stem cells are coming, we can kind of get the options down into three main different kinds of stem cells. When we're looking at the stem cells from the umbilical cord, these are omnipotent stem cells. They can go into an IV. They have extra exosomes, which I'll explain in a minute. But these can go into the IV, basically cross the blood-brain barrier in certain cases, and fix organs directly. So if we have arthritis, lung conditions, or even mental cognition problems, we're going to use these umbilical cord stem cells. The ones that we're getting from the Utah Cord Bank, again, have an FDA proven track record of no adverse medical events. So they're very, very, very safe, and they're very, very, very pure. They're the most virulent and the most versatile of all the different stem cells. There's been a development that we've all been waiting for, and that is provisionally approved Medicare stem cells. And so officially, we have an amniotic product that it's filtered the stem cells from the amniotic fluid, but it's basically working with exosomes, growth hormones, and special chemical mediators that cause your body to upregulate its own stem cells. The goodness of that is that we now have a product that Medicare will pay for. We've got to go through some extra steps to make that work, but it's a revolution. I mean, we really have turned the corner in terms of having acceptance for these kind of products. The two provisions on that is it's only approved for knee injections, or I'm sorry, joint injections. So knees are obviously the biggest thing we're using it for, but it could be for shoulders or finger joints or ankles or any other joint that has a synovial joint. It's a provisional approval, but we think it's the first step really in front of Medicare approved stem cells. So when we get a patient with that, we actually get your Medicare card or your insurance card, and we run it through a verification process, and we tell you right away whether you're a candidate for that. If you're not, there's still other things that you can do that are probably within your budget, but if we can get insurance to pay for it, we want to do that. The last item is pure exosomes, and exosomes are kind of an interesting thing that's come really to light in the last couple of years. Exosomes are microvesicles. So if you remember back from high school biology, it's the tiny little packets within the cell that carry chemicals. Well, these chemicals are anti-inflammatory and have growth hormones in it. So some people, some practitioners who are highly respected and who I personally like their work, are using exosomes rather than stem cells. We prefer stem cells in this clinic just because we've got the track record and we have the experience of it. We're beginning to use more and more exosomes, so we'll see how the future goes for that. Stem cell injections and exosome injections are really on par price-wise. They each start at about $3,900 an injection. So, the average person has a bill of like $3,900 to $6,800 to get that work done. This is down from about $15,000 2 years ago. So this is all going in the right direction. We're introducing a new product called Flower AmnioFlow. And Flower AmnioFlow is basically filtered from amniotic fluid. So it literally has no stem cells in it, but it has all the benefits of stem cells. So mostly we're looking at an anti-inflammatory lubrication of the joint. So Flower AmnioFlow is provisionally approved by the FDA and Medicare. And so we're still kind of in that experimental stage, but we definitely have a product that has a known track record that is being picked up by at least Medicare and some major insurance companies. When we're looking at umbilical cord stem cells, we're still viewing those as having the most growth factor, the most exosomes, the highest colony forming units. So we're using those for IV injections, which you can't use the AmnioFlows for all the systemic anti-inflammatory work. So COPD, any kind of lung or respiratory problem, systemic arthritis, and something we found out a couple years ago, the worse the arthritis is, the better these things work. So we're really at the stage of saying, these are the stem cells that should be first and foremost, and admittedly, they should be used for the more serious cases. If you have a more serious case, we're going to recommend umbilical cord stem cells. So again, exosomes like the Flower AmnioFlow don't have stem cells themselves, but they prompt the body to generate its own stem cells. So it has a growth hormone capability, an anti-inflammatory, and again, there are very, very skilled and effective practitioners who are only using exosomes. So to some people, they think this is the future. We think that they're on par with the umbilical cord stem cells. So looking at insurance, because finances are an issue with a lot of people. We probably have 500 people who came in for consults for stem cells for one reason or another couldn't afford them. So regular A and B, the B part of A and B Medicare, will pay for AmnioFlow stem cells if we establish medical necessity, do the proper documentation, and basically clear it through Medicare. So we put together a pretty exhaustive process to make that happen. The Medicare Advantage programs and the HMOs probably aren't going to pick this up. There's an old saying that a delay is as good as a denial. So within insurance, there's a lot of counterplays. So we're not really seeing the private insurance companies picking up on this. other regenerative, new regenerative procedures like synexis for peripheral neuropathy, they're a little more forthcoming with. With the AmnioFlow product, we've only really seen reimbursement from type A or A and B. So if you have Medicare Advantage, they're probably going to deny it. If you have an HMO or if you have like one of the big box store policies, they're probably going to deny it. So when we're working up these kind of patients, we actually had to put together 5 pages of background and investigative paperwork to justify the stem cell usage. So it's prompted us to make a lot of changes. As a matter of fact, it's prompted us to accept insurance billing for the first time in 10 years. So what does this look like? So joint injections are performed under ultrasound guidance. We used to have a C-arm, which is which is a computerized X-ray, and it had high levels of radiation. And there's people who think that that's the more precise test, but we think it's unneeded exposure to ionizing radiation. The good thing about ultrasound is ultrasound can imagine the inside, it images the inside of a joint. So we've got the joint image, we know exactly where we're going to go. The injection goes right in. We're not hitting arteries or nerves or any place that we want to do. It's a sterile field environment, and basically one injection in each joint that we need to treat has been our protocol. And as of now, 3 years into this process, we've only retreated like 1 or 2 people with the same joint. So it ends up being a one and done effect for the patient. So what are our clinical results? This is an actual spreadsheet of the clinical results. So we're measuring strength and range of motion in 5 different factors. So when we're looking at, let's say, grip strength, at leg strength, at the range of motion of the hips, neck, shoulders, we're getting people who are going, 90 degrees, being able to bring their hands all the way up. Our average patient is about 60 years old, and we're getting an average of 55% increase in strength and range of motion. So we've already sort of gone through the safety concerns. This is remarkably safe. There just isn't a downside from a safety point of view. The stem cells are ethically harvested and with high levels of clinical control. When the birth process is finished, the moms and the baby are both healthy, they're out of the room, they're harvesting them from the umbilical cord. They're then frozen in a completely unchanged form, in a complete natural form at -70 centigrade. They're then stored. We order them, and we order them for the individuals. We order them a couple of days before we're going to actually use them. We thaw them out. They're Federal Express here. We thaw them out, and 5 minutes later, they're in your bloodstream. So when we're looking at this process, then the big check marks that we didn't know 3 years ago. Is this safe? Does it work? Is the procedure in place? Those are 3 big check marks at this point. Our average strength and range of motion improvement is 55% for 60 and 70-year-olds. And again, if you went to a gym and asked them to make you 50% stronger, they would just laugh at you. A physical therapist cannot do that as an average. And no one in human history has actually been able to get results like this without the regenerative medicine. So again, the safety record is literally that. It is a recorded record. So the FDA has something called 501c reporting, which is the adverse medical events. And umbilical cord stem cells and amniotic products have had no adverse medical events, and that's in 100,000 procedures. So again, some of the simplest procedures, like getting your teeth cleaned at the dentist, is significantly more dangerous than getting stem cells. These things are safe. So a word on COVID. We have a 4,000 square foot clinic. We're running special air purifiers. We're using micellized silver as one of our disinfectants, in addition to the alcohol and the bleach-based disinfectants. One of the proofs in the pudding of two things I would say is that in 1,000 people patient base, we don't have any incidents of COVID-19 in our clinic community. I think it says two things. One, we're being careful, but it also says that the immune system of our patient base has been improved to the point where they could actually not come down with this. And so there's kind of nothing like a zero, negative percentage here. So we're looking at a very, very, very safe procedure. When patients come in, they're screened. So we're taking their temperature, we're making sure that they've sequestered, and then if there's any doubt about it, we're just delaying the procedure or the patient actually coming into our clinic. So looking at all this, who actually gets regen techniques? Who gets stem cells? Who gets amniotic products? Who's sitting on Synexus? Who uses pulse electromagnetics? And really, it's a cognition group who is going away from non-surgical and pharmaceutical solutions. One of the things that we've all seen is, I've had 7 knee operations. I had a patient with 22. It doesn't get better as you get more of them. And when we look at countries like Japan or Germany, when we're doing orders of magnitude more surgeries and using more drugs and having worse results, then going toward a natural solution becomes many people's choice. So it's not only safer, it's actually the medical protocol. So in medicine, you're supposed to exhaust conservative therapies before you do dangerous drugs or surgeries. And I think we've just forgotten that in this country. So regenerative medicine is sort of fitting in there after the steroid shots or after the collagen shots or after the opioids. You can do something before you would get a knee replacement or a shoulder rebuild or an arthritis operation and actually see what your body can do. In many, many, many cases, not just in our clinic, but across the country, the surgeries that were scheduled have been first delayed and then canceled because they were unnecessary. So the people that want the latest in techniques and really kind of leaving this conventional over-drug, over-surgery approach behind are the people we're seeing. And ultimately, it's the people taking responsibility for their own health. I think one of the things that we all have to kind of face is the days of paternalistic medicine are over. Your doctor is your consultant, and you're really in charge. So stem cells give you a tool that you can use to address your own health issues. So how do you proceed from here? One of my understandings about the world is that an understanding of things without an action plan is useless. So we're inviting you to come back in. So if you have insurance, we want to check it for you. If there's a way that we can use AmnioFlow stem cells on a joint problem, then we're going to try to do it. You can contact our office, 408-871-8222, say that you saw this film, and pretty much get yourself started. We want to see your old x-rays, your MRIs, any other lab tests that you have, and the evaluation. We put this together, and I think that for some people, they need a little extra inducement. So it's kind of a wake up from COVID kind of a thing. And we're going to select one person every 2 weeks from the patients who come in for a consult and provide an extra 5 cc exosome treatment. So what that will do is like in my case, I had exosomes put in the lateral aspect of my cervical spine. Every time I moved my head to the neck after breaking my neck a couple of times, it hurt with like 8 or 10 pain. Now I can do that relatively painlessly. So exosomes, again, are an anti-inflammatory growth hormone generating stem cell stimulating substance that'll help you heal. So one of the things we want to do is kind of offer a little inducement. So if 15 people sign up, then one of them will get 5 cc's of extra stem cells.